Before I begin and get all involved in the wonderful subject of children, I want to first thank you for inviting me to participate in this conference. It's an honor. I also want to thank Wendy Abrams and the Les Turner ALS Foundation for supporting me and coming here to be with you. Okay, ALS can do two basic things to a family unit. One, it can help them get closer together, or two, it can drive them apart. And by the way, I did not need to do any research to figure this out. No matter what country we're from, I think we would all agree that number one is preferable. We'd like to see if there's any way to help a family grow closer through this tragic situation of a parent having ALS. The way to get to number one is simple. I didn't say easy, but it is simple, and the key is communication. I'm going to be talking about the impact of ALS on young carers, who I'm defining today as 18 and under. Usually in our country, that's the age of children living at home, although certainly there are a lot of exceptions to that. But just for the sake of this conversation, in a CNN news report last year, they said that the long-term effects of being a child caregiver aren't really well studied. However, in my humble 15 years of having the privilege of providing in-home counseling to families, including families with children of an ALS parent, I have found the following 5 tenets to be true for the children in ALS families. Number one, they will always remember how they were told about the parent's ALS. I'm going to be coming back to these to talk about, as professionals, what we can do to help the children, but I just want to go through them quickly. Number two is that they will feel that they are different from their peers. A child who has an ALS parent is not the same as most of the other children in the classroom. Those of you who are parents or no children at all, you realize that it's not a good thing when kids feel different unless that particular child chooses to color her hair green or get a body piercing or something else that makes us crazy. Then it's okay, but if the change or the difference is imposed, it can create a lot of stress for that child. Number three is that you can bet that those children of ALS parents, they are worrying. They will all show their concern very differently, but they do worry. However, it's not always what we presume they're worrying about. The kids have taught me that over the years. Number four is that they will experience a myriad of emotions, just as we adults do. Sometimes it's expressed a little differently because they're children, but they will experience many, many emotions. And last is the fact that it will change the children forever. I think that's the one that most of us and most parents are fearful of, but I will get to why that doesn't have to be a bad thing. So I'd like to tell you a little bit about how to help minimize the ramifications of the children's experience with ALS through counseling interventions. So you don't always get a chance to work directly with the children. I don't know how many of you in the group are as fortunate as I am to actually go into the homes where you can provide counseling to the children. But even if you can't do that, if you work with the parents or grandparents, if they're closely involved, you can help the kids by sort of coaching, if you will, or counseling the grown-ups, because those are the people who will help the kids. So going back to number one, the kids will remember how they were told about the ALS. This is a day that will live forever in their minds. There's a lot of ways to do this. And as professionals, we want to make sure to counsel the parents on how to do it. And out of all the families with children that I work with, that's the number one question. How in the world do we tell the kids? Of Of course, there's not just one answer. There never is. This is not easy. But part of it is simple. The first thing is, make sure that's on there. Okay. The first thing is that the parents need to take some time to assimilate the shock themselves. While I'm a big believer in telling the children, don't keep secrets. Also, don't go telling them everything before you can wrap your own head around it. And sometimes that can take months, years. But I think we've all seen that the parents come to a point where they can speak about it without crying. They can have a pretty reasonable conversation. And when they feel like they can do that, then they've got some emotional strength and they can consider telling the kids, which of course is different for different age children. You know, you don't tell a 6-year-old the same thing you tell a 16-year-old because developmentally their brains are working very differently. I don't have time, and I won't go into all the differences between the different ages, but just be aware that if you're with a family that has a variety of ages of children, they may need to separate the little ones from the big ones, or, you know, 1 and 1, whatever the number of children is, it doesn't matter. It's the ages of the kids. You know, I work with one man right now who's considering going on an event, and he's got a 14 and 15-year-old son at home, but they have a 26 and 28-year-old daughter out on their own. So that's a good example. I use the analogy that I heard on the airlines coming here over and over, put your own oxygen on first. That's the idea we want to give to the parents, is that they have to get it together a little bit themselves, and then when they decide to tell the kids, they may need to have their parents there, if their parents are alive and willing and able to be part of it, friends, anybody who gives them strength to manage the situation of telling their kids that one of their parents has ALS. But you want the parents to come from a position of emotional strength. I'd like to share a quick little case example on this one, and I'm spending so much time on it, again, because it is my number one question that I get, and it's so important. It sets the tone for how the whole family will deal with the disease progression, whether it's a year, 5 years, however long it is. But I worked with one mom who was 37 when she was diagnosed, and her 3 little girls were 3, 5, and 7. So going back to one of the other conversations about how do we manage our own emotions, I used to just leave their house and cry. I had a lot of crying in my car. But I worked with the patient and her husband, away from the children, away from the house. They used to meet me, and we'd talk about all of the difficult things, including her advanced directives, if she wanted to go on an event, all of those things. And always part of the conversation was the children. When they finally decided they were ready to tell these 3 little gorgeous kids what was going on with their mom, the decision was that her mom would come in from Michigan, and another really close friend, who I think was a godmom, would be there, and that she was gonna let her husband talk to the kids, but she'd be in the house, sitting in the kitchen and just sort of waiting to join them. Okay, he got 2 sentences into it. She went, no. And she didn't like how he was saying it, and she thought she could do a better job. So God bless her, she went right in and sat down with the kids, and they cried together, and then they went on with the business of their day. But you can plan with them, but when they get down to it, it's that emotional strength that will determine how they handle it. Number 2, they'll feel that they're different from their peers. So what do we do to help them? Kids don't like feeling different from their peers. We know that. Validate, and tell the parents to validate, and tell all of the adults in the kids' lives to validate for them. This is really hard. We know this makes you feel different. We know that your friends, parents aren't like this. We get it. Usually when kids feel like someone understands, it's kind of like us. If somebody understands us, we feel a little stronger. We feel like we can manage it. That's how our kids will deal with it as well. We need to validate those feelings, and then we need to provide some options. Sometimes we can connect the children with other ALS families. We have family days and hoping to possibly do a children's camp, as Jody's doing. She's not here this morning, I don't believe, but she was here yesterday, and she's doing the Hope Loves Company camp for children whose parents are either living with ALS or have died from ALS. But you want to either connect them with another family, see if there's somebody in their class who has a parent who is ill, even if it's not ALS, or these are a few really good online resources. Okay, going back to the fact that they'll worry, but not always, and that we should ask. I had an 11-year-old who taught me this so well last year. You'd think after all these years I knew what I would know what I was doing. And so when this little girl said, "I'm so scared about being at school, my mom's home alone," her mom has the ALS obviously, "and I really need to talk to her and I'm so worried," and you get the picture and my heart's breaking, thinking, oh my gosh, this child is really finally understanding that her mom is gonna die. I don't know if her mom has really talked to her about that fact yet, not knowing exactly where I should take this conversation. And then, thankfully, I stopped talking and listened, because she wasn't talking about her mom dying. She was talking about her mom falling, because she had been home the month before when her mom fell. And she hit pretty hard and it was pretty scary. She turned out to be, relatively okay, but it scared the heck out of this 11-year-old. She was the only one home. So while I think the issue of her mom dying was definitely on its way into the conversation, that's not what she was talking about that day. So as professionals, if we are fortunate enough to work directly with the kids, we want to ask, don't make assumptions. And if we're not working with the kids, please guide your families with children to ask. Don't ask the kids, do you have any questions? That's the best way to get kids to not talk to you. Think about it. Talk about being on the hot seat. Do you have anything you want to ask me? No, no, not at all. That's way too scary. But we want to keep in mind that we don't want to make assumptions. The fact that the kids will experience as many emotions as we do is sometimes kind of scary, but it's necessary. They're going through it, right, with their parents. So the important fact to keep in mind is the same thing that we want to tell our kids who are not in ALS families, which is really anything that you feel is okay. All of your feelings are okay. We don't have control over our feelings. They live in our bodies. It's what we do with those feelings that determines if we're handling things appropriately or not. You might want to, just an idea for keeping that in mind is the fact that a 13-year-old from an ALS family is a 13-year-old first. I happen to have one of those at home, so that came to mind. And think about all the hormones and the wild things he's doing that make no sense. And thankfully, there isn't an ALS parent in our home, but he's still crazy. I don't know where he gets it from, but it's because he's 13. It's developmentally appropriate. Keep those lines of communication open. Last but absolutely not least is the fact that the day that a child hears, a child of any age really, if you think about it, but we're talking about the kids under 18, the day a child hears that their parent has ALS changes them forever. This is probably the second most common question that I get from the families with kids. They're very concerned that this will basically mess their kids up, as we would say in America. This is really going to mess them up, and it's out of our control. And that's the whole point. It's out of our control. So what can we as professionals tell those parents to help those children? First of all, going back to the communication. Open up the lines of communication. If it's too difficult for the patient or the well spouse to talk with the kids, then bring other people in, as was discussed earlier. It doesn't have to be the parent. But there have to be trusted grown-ups in those kids' lives on a regular basis that can have these difficult conversations and also just be there to do what I call opening the door. Just open the door. Just mention something about, oh, your mom went to the doctor again. Don't say, how do you feel about that? Say, oh, I heard your mom went to the doctor. Just open the door, let them know that ALS is okay to talk about, and eventually you'll find out what's on their minds. But you can't expect it the first 10 times you bring it up. So we want to tell our families, you just have to make this part of their lives. And we want you to try and live with it, not to die with it. And living with it also means trying to keep as much normalcy for those children as possible. Okay, I see him coming up. I see that. I'm going to sneak one more minute in. I want to tell you really quickly about a family with 8 and 10-year-old boys. The dad had ALS, and these are the boys I probably worry about the most as far back as I can remember, because the further along they got into the disease, the less we were allowed into the home. Even our home team nurse wasn't even allowed to see the patient. She could just talk to the wife. I made an appointment to go and see the boys when I heard he was very end stage, and the wife wasn't there, and the patient's brother said, why are you here? I said, oh, to see the boys, and I walked in, and it was kind of sneaky, but it worked, because those kids need way more help than I could give them that day. But at least that day, I could give them the idea that there are adults who could help them, and I made that suggestion to them. There are social workers in your school. That's another thing, as professionals in the clinics or wherever you are working with our patients, let the grown-ups know that there are a lot of people who can help their kids. If they're too overwhelmed, then they don't have to do it themselves. I could give you several explanations as my timer's going here, that there are many families who have done this really, really well for the kids. And the way they do that is by telling the kids early on what's happening, because the kids kind of pick up on it, they know. And then they made it just part of their lives, not their entire life. So thank you for your attention and for having me.
Thank you, Laurie. Yeah, am I on? Yeah.
Good morning.
Okay.
Hi,
Good
it's
morning.
Rebecca Axline from Methodist in Houston.
Hi, Rebecca.
Hi. Excellent, eloquent illustration. Just one
Thank
quick
you.
question. Do you also counsel them on the balancing and not over-parentifying children if they're involved in actually the physical care as well as talking about the emotional issues?
Do I count? Wait, let me make sure I understand the question.
The parents around a lot of them fear that they're going to make their children become more parentified or adults if they're involved too much in the day-to-day physical care or whatever.
Yeah.
Do you help counsel them in terms of the balance of that?
Yes, that's a great question. Thank you. And it's another one that a lot of families worry about, which is how much actual physical caregiving should the kids do? Again, there's not an easy answer, because every child is different and every family is different. Every family's dynamic and situation is different. So the basic rule of thumb, number one, is we want to ask and try not just once, but find out, does the child want to help? That's the biggest issue. We don't want that child to resent the parent for being sick. So would you like to learn how to do this? Could you please go get, maybe start out with some things that are not real medical, like could you go get that other pillow from the bedroom? Dad likes it behind his head on the wheelchair, and see how they respond. So that's what I counsel. I suggest you start with things that are not real medical, they're just kind. And they may not feel like caregiving per se. And then if that child is responding and that child seems to get some self-esteem and confidence out of being, you've got those kids who go, I'm helping. And it's really good for them. You can see it in their eyes. Then you let them do more. But the kid who's almost physically backing away, they just go get a pillow. And you try the other most important thing, thank you for that question, most important thing we can tell our families is to tell those kids that however they want to behave in terms of not, causing trouble at school, but towards that parent. If they're a little leery of being near the parent, we want to help them feel better about it, but we never want them to feel judged for it, because when this is all over, we don't want that child to have regrets. So that's really the most important thing we can do. Thank you.
Now, question over here.
Richard Sloan, palliative care physician from the UK. Thanks very much. It's a very difficult area. I just wonder, when you are coaching parents as to how to break the news to the kids, as we say, it's a day the kids will never forget. How much should the parents tell them?
Okay. I'm going to get in big trouble, so I'll try to be brief. How much should we? It's okay? Okay, thank you. How much should you tell? The question is, how much should we tell the children? Okay, well, that's what I was alluding to when I mentioned a child who's 6 versus a child who's 16, just as an example. You want to tell the kids, first of all, you want to lead with your heart when you're talking to your kids. Second of all, you always want to tell the truth. Third of all, this is just my personal opinion, don't ever say to the kids, well, we're all going to die. That is not what they're looking to hear from you. They want the truth. If you say, well, we're all going to die, how come everybody in the family's crying then? So for the younger kids, and another variable that comes into play here is a family's religious and spiritual beliefs. So you can bring that in any way that's right for the family. But again, don't make assumptions, ask them. But for the younger kids, you want to let them know that mom or dad has a muscle disease, give them the name of it, and say that this is what's making him need a walker, or this is what's making her speech sound funny. And again, depending on the age, you start with the concrete. And you don't have to do this all at one time. But eventually what you're going to get, and this is another huge question I get from the parents, what do I do if they say, well, is he going to die? That's where I was going when I said, don't say we're all going to die. That's not what they're asking. If they give you that question, they want the truth. And a really great way to answer this is to say, right now, the doctors don't have a cure to fix this disease, but there's a lot of really good doctors, because we don't want them to be afraid of doctors like some of us were as kids. A lot of really great doctors and scientists who are trying to find a cure, and they're helping him as much as they can. Telling them the truth, aren't scaring the heck out of them, and then you see what they bring back to you. One thing to keep in mind, especially with the younger kids though, I learned this from an 8-year-old about 12 years ago. I had been working with her for 2 years when I found out that every day reason she was acting out was every single day she was afraid when she woke up her dad would be dead. So as the conversation goes on, you want to let the parents know to be aware of that fact, that you say to the kids, listen, right now, he's coming to your soccer game. Bring it back to that now, that mindfulness. Bring it back to the now for the kids. They're so good at that anyway. But, he's going to do this, and then next week we're doing that. And that's not lying. That's setting an example for them of how your family's going to handle it. For older kids, you need to be a little bit more, give them a little bit more explanation, because those kids can get on Google and find out the whole thing. So you want to tell them, I know you can look this up, but if you're going to look this up, I want you to look at this website, because this one is legitimate. And you can talk to me and ask me questions anytime. We're going to do everything we can to keep them as healthy as we can for as long as we can. Those kinds of lines are truth first, concrete, and leave the door open for more communication. I hope that helps.
Laurie, can I ask you a question?
Sure.
So, having been a young caregiver myself, to a parent, not of ALS but another condition, and having no siblings, you've talked about the age differences in children from young to old. Could you comment about any differences in dynamics where a young caregiver has got siblings and where they're a single child?
So the patient has siblings?
No. The young carer has no siblings or does have siblings, so different dynamics.
Okay, I think I've got it. So if there's only one child in the family versus siblings?
Yes.
Okay. Again, you first have to start with the age, though, because developmentally, there's just certain things that a 13-year-old will understand whether or not he or she has siblings. However, very good question, because if there are no siblings, then who is that child going to talk to? What peers will that child talk to about what's going on? So I'm going to tell you, the siblings are totally in cahoots. When there's an ALS parent, they are talking. I have evidence, I have stories to tell you about this. Or, the 10-year-old telling the 7-year-old, and then they said to the mom, "Oh, come on, we're not stupid. We know what's going on," quote unquote. Seriously, that blew me away. You could tell. But I think that with that family with an only child, there's maybe a little bit more of a tendency for that child to be more of a caregiver. So we want to be mindful of that and not push the child into that role. The child's still the child and the spouse is still the spouse. When there are siblings, we have to make our expectations very, very clear, because you cannot expect the same thing from the little ones as you might from the older ones.
Thank you. And I have last question at the back then, please.
Teresa Imparato, Greater New York Chapter of the ALS Association.
Hi.
So I've had parents who want to protect their children and they don't want to tell them, but they've told every aunt and uncle who's probably telling the cousin, or they've told every class mom, if my kid is late for school or whatever. So the child is going to hear it from someone else first before the parents. How do you encourage those parents to get the word out first?
Thank you. A little part I had to skip because I was watching my timer, but thank you for asking. Great question. Okay, that's really the worst scenario, is to tell everybody else in the children's lives except the children. Even if kids cannot tell you what's going on, they sense it. And so how do you kind of convince the parents who want to keep the kids safe, or, well, I forgot already, I'm sorry, how you protect, thank you, word find. How do we protect the kids and give them the truth? It's pretty tough. Here's what you have to tell those parents. You have to tell the parents that the part we can't control is that somebody that the kids love has ALS. We have no control over that, but we have a lot of control over the kids still being able to feel like they can go to their parents, the people that they love and trust the most, and they can still keep going to their parents, despite the fact that one of them has ALS. If kids are not told by the parent and they hear it in school, and I've had that happen too. I had a 7-year-old boy come home from the parochial school and ask his parents, "You never told me that Dad was going to die." It's been an interesting year with the kids. But that was because the whole church community knew. So if you're going to let it out to everybody, then first you tell your children, because you will break the trust with them if, as parents, you aren't the ones to tell them. By telling them, you are protecting them. Even though I'll tell you it's counterintuitive as a parent, and I know this. And that's why I suggested that we tell the parents, bring in your parents, bring in your closest friends, bring in your siblings, the kids' aunts and uncles. Whoever needs to be there is okay. Personally, I like to suggest a fun activity after telling the kids this awful news. I'm not kidding, I've done it in my own family. You tell them this, and then you have friends that you're going to go out with. and it really sets the tone for how the family will manage. But the number one, sorry, I digress, number one thing to get parents on the bandwagon of why they are protecting their kids by telling them is because of how messed up the kids get by hearing it at school. Thanks for asking that one.
Okay, thank you, Laurie.
Thank you.
Fascinating session this morning.